Good morning, Uganda. Welcome back from the business desk. It's time for the agenda. My name is Julie F. Nantaba, and this morning we are looking at the role of RDCs or RCCs, but this time around shedding more light and ensuring proper health care within communities. Be part of the conversation, 0709-602-592 by text, WhatsApp, and engage. My guest this morning is a usual suspect when it comes to these matters, always learning a lot from her hard work, her practicability, but definitely also her experience as well. That is Nalongo Phoebe Namolindwa, the RDC of Kasanda District. A pleasure having you this morning, ma'am.
The pleasure is all mine.
Ave Kasanda, how are they?
Ave Kasanda, they are okay. We are moving on as usual.
Lovely.
Of course, we are getting some rains, but of course we also have a lot of dust, and the rains have affected most of our roads because we have wetlands. Kasanda has many low-lying areas which have actually been degraded. Yesterday I was talking to my superiors about the degradation, the level of degradation of the wetlands in Kasanda, and it's extremely alarming. So we are going, from here I'm going to go and sit with the cow so that we see what can be done, because people are taking advantage of that natural cover. And it's going to affect the entire country. It
does. Yeah. It definitely does, and I'm glad you're taking action on that. But this morning we are looking at ensuring proper health care within communities, a very pertinent issue to talk about, a very important one, a very deep one at that, because we all relate with the fact that when you go to a hospital, you might find medicine, you might not find it. You might find a hospital, a government hospital that's meant to give you free services because it's already paid for by the government, where someone tells you that before I touch you, you have to pay ABCD. So let's learn a lot on how best we can enjoy the services that we are given as citizens of Uganda. Now, how would you describe the role of an RDC in improving healthcare service in a district?
Okay, like I always say, RDCs and RSCCs are presidential appointees, and their role is monitoring. The biggest role, or what we do most, is monitoring and providing oversight. So when you look at health specifically, health is such a pertinent issue because you need a healthy mind, a healthy body for you to be able to do whatever you need to do. So as an RDC, my major role, like I said, is monitoring and oversight. So we are responsible for conducting impromptu checks, visits in health centers, that is to health center 4s, health center 3s, and 2s, which are ideally getting phased out. So we are responsible for ensuring that we go in there, visit these people, to find out who are absent, who are present. We look at the PHC funds that are sent from the ministry to these health centers to find out whether these funds are being utilized the way it's supposed to be used. Then we also look at the projects that are ongoing in these particular health centers. We look at the equipment, because government provides equipment in these health centers, especially center 4s and health center 3s. So you find that we need to ensure that we go in there, find out what is not working, what is not doing, which drugs that were delivered when, then also inspect the infrastructure, like I said, the projects that are ongoing, like in Kasanda. We have quite a number of projects that are ongoing, a lot of construction. Some of the construction has stalled, like the one of Namawa Health Center 3, sorry, but with a continuous engagement. Initially we had, this was actually carried also by the Auditor General's report. It was something that was put in there, and I'm lucky that, of course, the contractor wasn't coming forth. So I was informed the other week that the district, the COW and her team managed to get new contractors, and I think they're already on site. So when I go there, I'll make sure that I try to find out what is happening. Then we also have the issue of coordination during health emergencies. Like I said, sometimes people refer to me as the pandemic RDC. Why this happens is because I have handled pandemics like COVID. By the time COVID broke out, I was the RDC of Luwero, and then I was chairing the task force there. Then when I moved to Kasanda, I have handled Mpox followed me to Kasanda, and then we also had Ebola at that time, and now we are having an outbreak of measles in Kasanda, and we've been conducting, which I think has we're concluding today, or we concluded over the weekend. We're doing a mop-up of, because we got like 5 samples. We got people that came into Uganda Health Center and samples were taken from them, because the health officers there, or those that were the nurses and the doctors that were there, when they moved in, they looked at they looked at the signs and symptoms that these people were exhibiting, and they realized they were similar to those of measles. So they sent them to our lab in Kampala, and those results came out. Out of the 5 samples, 4 tested positive with measles and rubella. So the ministry declared Kasanda to be having measles outbreak, and so we ensured that we held a first coordination meeting to try and coordinate and see what we have, how we are going to do, assemble forces or teams that are going to go or that have been moving in the various places, and then also come up with a work plan of how we are going to reach these particular people, and also most especially do risk communication, which is more or less sensitization, because we try to talk to also some of the implementing partners. We try to bring people on board, and also the religious leaders and what. So Kasanda, it's not the first time we are having measles outbreak, but it seems we have a mobile community, because when you see Chiganda is along the highway, that is the road going to Fort Poto, Mubende, Mitiana. So that's where we pick the samples. But I have a mobile community that where one of the biggest economic activity in Kasanda is mining. Yeah, we have a lot of artisanal miners in Kasanda. So most of them are mobile. They keep rotating from one place to another. So somehow I feel that it is partly why as Kasanda we are prone to so many infectious diseases. But I'm glad that the DHO and the team that I have in my office, and then also the district at large, and the local leaders, the LCs, because I work with all of them in ensuring that we keep our communities safe. So I work with the local leaders. I do a lot of community mobilization, because like now, like you're saying, like I've told you, we have the outbreak of measles and rubella. So it is upon us to work with the LCs, to work with the religious leaders, to work with traditional healers, to work with everyone in the community, in ensuring that one, we deliver the message. Okay, and I'm glad that Kasanda is one of the districts where the ministry gave us this program of Choose. That is those ones that are supposed to help us at the like basically at the parish level. So these Choose, where they're training. They always do a 6 months intensive training, and it was done last year. They finished their training in December. So we're waiting, of course, for them to be for them to graduate, and I think the minister has that in plan, because I've seen her going around the country basically handing over some equipment to help them. But at least they have the information, they were trained, so it's just waiting for the gadgets. But now we've already commissioned them, I would say.
Right.
Yeah, we've already commissioned them, because they're amongst the teams that we are using to ensure that we do the mop-up, and then also the VHTs. Because in Kasanda, being of course the chair of the task force, we also have task forces at sub-county level, we have task forces at parish level, we also have task forces at the village level, and all those ones are comprised, they have like more or less the same composition like the one of the district, but since these ones are closer, so we rejuvenate them and tell them what to do, and then they move out to the communities. The VHTs do door to door. So my encouragement to the people is that we always handle things as they come. So Kasanda, of course, we have some people that sometimes meets and things that people, like sometimes when it comes to government programs, you know, people sometimes tend to think that these programs are it's unfortunate, but they have different sometimes negative perception towards them.
Yes.
But then we try to ensure that we sensitize them and let them know, because a government program is a government program, and health cannot be discussed. If government realizes that there is no government that can be there and it wants to kill its people. So when we come up with a government declares, or the government through the Ministry of Health declares that there is this particular outbreak, then it's upon, the onus is on us, because we are looking at 9 months and 5 years, and those people are being vaccinated and immunized. So it's a continuous process.
Right.
Yeah.
And I love the fact that indeed you share examples like health is health, and there are no discussions there. So how do you ensure that national health policies are effectively implemented at district level?
Yeah, so number one is ensuring that, of course, you get to know what policy are you looking at. Yeah, so, and then you try to break it down for you to be able to understand it or conceptualize it as a person, and then you can be able to disseminate that information. So when these policies come, or these policies are, we get to know about them. Of course, we have the task force, like I said. That task force is where we discuss most of the things. I have the district health team that is part of the task force. So we try to break down whatever we get from the ministry, whatever guidelines we get from the ministry, and then we try to ensure that this message trickles down. Like I said, we have the task forces at the sub-county, we have task forces at the parish level, we have task forces that go up to the village level. So these don't work in isolation. Of course, they work with the teams there. But what we do, we also get to radios. Yeah, we get to radios because radios are more or less like the easiest way of reaching a bigger coverage of people. So we try to break it down to them, and also encourage our health workers, the ones specifically at health centers, that is the health center force, the in-charges there, to ensure that they do more outreaches in the community. Because to me, I believe when, like now, the policy that we are following of ensuring that we do a lot of community prevention, so whereby we see to it that the diseases end in the community. Because number one, Kasand of course received its cycle of the medication that is, or the drugs that were sent by NMS, and I received messages, the whole of last week I was receiving messages about the drugs that were taken to, which drugs are being taken to which facility. And so when we get those drugs, that is when you can be able to let the people know. The GISOs you activate basically all the structures so that they can be there to be able to witness these drugs and get to know which drugs are there. And then you also have a discussion about the diseases, whether the drugs that have been sent are the ones that the teams requested for, and also are helping us to identify, or rather to handle the infections that are in the community. But going back to what I was talking about, the issue of the policy that we have, that the ministry is trying to push for, we are looking at ensuring that we sensitize the community. Okay, like the parish chiefs that are there, we've oriented them on their role, and also amongst the roles they have, they also have to ensure that we have a safe community. So you cannot be a parish chief in a parish or overseeing a parish of like 8 villages when people don't have places of ease. They don't have toilets, they don't have hand washing facilities. Because, you know, during Ebola, I realized the fact that we've had these infectious diseases, that all the pandemics, the pandemics that have hit Uganda, have made me realize that, you know, as Ugandans, there are certain things that we take for granted, especially in terms of health. By doing one simple thing of ensuring that your hands are washed, it actually saves you from so many. Go back to the roots and ensuring that, because we always tell our people that when you wash your hands, you actually save. You find that some of the diseases that are in there can actually be prevented. So we're encouraging them to ensure that they do that, and then you will see that us who keep making or crying out that the drugs we have are not enough, we don't have these drugs in the facilities, you find that doctors will be, or nurses or assistants will be in these health centers without attending to clients, because we would have healed or secured our people by ensuring that they practice the basic health care in their homes. Yes. 0709-602592 by text, WhatsApp. We are looking at the role of RDCs and RCCs in ensuring health care, proper health care
within communities. Over time, we've learned the overall role of RCCs and RDCs, but this time around we're shedding light on healthcare in communities, and I know this is an issue that affects you as well, so be part of the conversation. 0709602592 by text, WhatsApp, and engage. Good morning, Ugandans. Farmer here who greets us. Good morning to you too. Thank you for being on the show. What are you learning? What are you unlearning? What's your question? Be sure to be part of this conversation. Now, let's look at how you work with the different officers in just a breakdown of, for our viewer to understand. How do you work with the different district health care officers to make sure that the service is delivered at ground level to ground level? Okay.
Like I said, number one, I'm the chair of the district task force. And being the chair of the district task force, it has several members, including the COW. And also the DHO can be co-opted based on whatever we are discussing about. So having that security team there, and then also having a coordination team, that is the district task force, it exposes me, or it enables me work with the DHT, that is the district health team, which teams have a responsibility of doing support supervision in all the health centers that we have in Kasanda. And I'm glad that Kasanda, almost all sub-counties, apart from I think one, Kasanda is a young district, but the things that government has given us, the achievements that we've received within this small period of like 6 years, 7 years is quite overwhelming. Kasanda, I think, has only one sub-county that has no health center, 3. The rest of them have health center 3. So what does that mean? It means that we have people that are there that are meant to be able to ensure that they extend services. And I'm glad, because one of the other things, the health centers are there. Government has constructed these health centers, but we have some of the challenges that are still affecting us, because now I'm trying to break down to the people I work with, because I have a thin workforce, that is the human resource. And I'm glad that we got a waiver, and the government, through public service, have given the COWs and the districts leeway to be able to recruit health workers, because I've been operating at a percentage of like 38% staff. And these are people that are expected to run around. And these are people I worked with to ensure that we fight and make sure that the community is safe. So it's been a huge, it has had a huge impact on them in terms of service delivery. But I'm glad that we are going to recruit new staff. We are going to have a biostat, because now biostatistician, that's a very, very important role. And I remember discuss with the DHO and also the COW, informing them that most cases, sometimes when I walk into the Ministry of Health, it has a huge dashboard. And sometimes when you walk in there, you realize that Kasanda is sometimes always in red or orange. So I told them that, the data that is within the district does not reflect what the ministry receives. So I said a biostat, because she's responsible for ensuring that she collects the data, analyzes it, and sends it. So I work with, of course, the DHT. I work with local leaders. I work with cultural leaders at local level, and those are the ones that help me trickle down or disseminate information to the sub-counties, to the villages. So like I always say, when you have an empowered community, then they can actually help you. Then we also hold barazas. Yeah, we have barazas that we hold in the communities discussing health. We had one in Makokotuo, that was I think like 3 weeks ago, where we just try to assess, look at people, and then get to show accountability for whatever we receive, so that the people also can get to know. And then I also encourage my DHO to ensure that as they are doing support supervision, or as we are doing support supervision, monitoring whatever is happening, we encourage, since we already activated the sub-county task forces, the LC3s are supposed to be getting information from the in-charges of all health facilities, because those are members of the district security, the district security committee, but then also rather members of the sub-county security committee, but also the task force. So I always encourage the in-charges to always inform the leadership where they need help, and also to have a discussion about how to be able to improve the health within their community.
Right.
Yes.
Good morning, Uganda. This is a youth chairperson, Lugazi Central Division. Mukisa Pius, our visitor, Madame Namulindwa, RDC Kasanda District. I'd like to ask you, what are the procedures of voting VHTs? And not every RDC or RCCs know more about health issues, but I have learnt more from Madame RDC Kasanda District. Over to you, ma'am.
Okay. Well, number one, VHTs are not voted. That is, I want to put that disclaimer, they are not voted. These are volunteers that we have. So I think you've never seen a volunteer being elected or voted.
Right.
Yeah, so these are people that come up within the community, they offer themselves, because previously they have not even been earning a penny. Yeah, they are basically, they work on moyo gwagwanga, if I may put it that way.
Right.
But they want to see to it that the communities that they live in are safe. So my dear chairperson, being a VHT is voluntary. They are paid an allowance once we have activities that are ongoing, but they are also part of the village task forces, meaning that it is a continuous process. So we've been pushing the ministry to ensure that it finds funds to secure and be able at least to give them an allowance, a monthly allowance. I don't know how far that has gone, but the information I got is that I think they started receiving something. And also the fact that now we have, it has also been elevated to the CHOOS. Now CHOOS, these are going to be stationed at the parish, but you know a parish is within what? Within a village. So these ones are responsible. These ones are going to be earning a monthly allowance. They are given equipment to ensure that they be able to traverse their communities and report to the sub-county and then also the district in case we have any issue regarding health that needs to be talked about, but also other issues. Yeah, not only specific. Yes, I know their mandate is health,
right,
but you can find that health is intertwined, or there's a way it synchronizes with other issues in the community. So as long as the community has an issue, we can also use the CHOOS and tap into their network to be able to ensure that we protect our community.
All right.
Yeah.
Good morning, team in the studio. I wish all RCCs and RDCs could copy from her. Health issues within communities will be reduced. Drugs disappearing in the hospital also would be reduced. This is Akeba Williams from Napak District. Thank you, pardon me. Thank you, Akeba, for being on the show. And thank you, Ms. Phoebe Namulindwa Nalongo, for your insightful discussion on the vital role of RDCs and RCCs in ensuring proper healthcare at our health centers. Your commitment to accountability and better service delivery is truly inspiring. Keep up the great work. I remain teacher engineer Kato Hamuza in Makerere University. All right, there you receive your flowers. Now let's look at measures and accountability. Just paint a picture of what measures you take when there are corrupt people or reports of corruption within the healthcare system, drug theft, or even absenteeism of healthcare workers.
Okay. Number one, I want to thank the community. Because of the fact that they always get information, we find that we get quite a number of whistleblowers. Yeah, whistleblowers,
an empowered community.
An empowered community,
Right.
like I always emphasize. So we get whistleblowers because we have eyes almost in every sub-county and in every village. And most of these people have our numbers because we share them. So they always inform us. The Gisos are always traversing. The Gisos are Gombola chiefs, they're always traversing. Yeah, and most of the times we always encourage them not to, because sometimes you find that since Gisos are within the areas, they have also been accused on a number of occasions being able to shielding those that commit crimes.
Right.
But every time we get to hear or get information about such negative actions that affect the community, because when you do that, then you're impeding a community from prospering. So we have whistleblowers who are protected, and I think it's like 2 months ago, we work with the State House drug monitoring unit. We work with also police. We work with the CID department. So I think 2 months ago, we had an incident where drugs were found at one was there is a person who was one of the health workers was caught red-handed having stuffed ARVs and some other essential drugs in a latrine.
Hey.
Yeah, and that information, of course, it was a whistleblower. Teams came in, they raided the place, found those drugs, and that person was picked and taken to Kampala for further interrogation. And I have not yet found out where it reached, but at least I had a discussion with the officers that were sent, the lady that was the ASP that was in charge of or was manning the operation. And then we also have others. So if we continuously do audits, because what I always encourage the DHO and in charges is to always do an audit on the drugs that come in, then you must have a rota of who is present, who is absent, okay? Because at the times you go in there, we've been having people that go on study leave, and the cow, neither does the cow or the DHO know. And people are in there, and remember now the fact that the president has pushed for increment, or pushed for increment of scientists. So you find that they are doing a disservice, because I know at the back of the mind, because of the so many recurring pandemics that we've had, it's maybe something that triggered the president to realize that there is a gap. But you know, I am one person who also thinks that if you're paid, you've been getting a salary of 1 million, okay, and then it's increased, it shoots up, like it actually doubles or triples to like 4 million, which to me I think is relatively okay, because remember, you've been surviving on one, now you've been elevated. So please don't do a disservice to the community. Those people that are out there, it is, you studied that particular, because for me, I believe being in healthcare, I did buy the home-based care nursing recently, and I go to Wakateyamba in, that is in Narukorongo, to render. So it's something that I said I would do just to give back to the community as a Catholic. So when you get there, you know, for you to be able to understand what it means, to me I believe it's a calling for you to get into the health system, because you will not go anywhere where you'll be paid enough. And as a human, as human as we are, every time our needs evolve, our tastes and preferences evolve. The more money you get, the more needs, you know, because now you start shifting from a person who would be eating 50 or 20K. Like after a week, you realize that now it pushes to, because you've gone from the chikumi, now you're going to, you know, that is now human nature. But when you're paid money and you do not do what you're supposed to do, may I believe that goes back to self-conviction. Right. If you're given money, if you're given taxpayers' money, ensure that you render service. So issues, whenever I have discussions with the health workers, I always tell them I'm not an expert at health, but I know that my actions can be able to save a life. So if you can do that to a person who has come from wherever, and they're looking at you and their life is in your hands, then why don't you be at work for you to be able to do? All the health workers know what to do, but we always choose not to do what we're supposed to do. And that is a personal issue, and it goes back to character. But me, I know the God that we serve is seeing, and he watches all of us.
And the moment you're got, there's no excuse for you getting behind bars. Now, good morning, Uganda. I'm Jafari Chan Kaliro. I would like to know, are those staff also displayed on the government payroll? Some of the stuff you talked about, the health stuff you talked about that you're getting with the help of the HR. Okay, yeah, those, it is mandatory. When you enter a health facility, on their boards, notice boards, they're supposed to have a rota of who is present, who is working, who is doing what. Okay, so that division of labor has to be there, and that's one of the responsibilities of the in-charge. So if you have an in-charge that is not displaying who is supposed to be where, at what time, then that in-charge is what? Is lacking. So it is like going to school. I would give an example of maybe some of us who are, because me, I'm a teacher by profession. So when you go, you must have a timetable. Okay, and that timetable must tell you that at this particular time you're supposed to be in this class, and once it's done, then another person comes in. So it is the same thing in the health, because a health facility is an institution. So you must know who is responsible for what, because that one also helps us as we monitor, you know, with the health care. You do not, if something is not recorded or documented, then it's not been done. So if you do not document that this person at this time
was supposed to be in this particular ward, was supposed to be doing this, then we might not know, in case someone is, if anything is to happen, that person is supposed to be liable. So rotas or duty rotas are supposed to be displayed, clearly displayed in the health facilities.
Right. Yeah. We're looking at the role of RDCs and RCCs in ensuring healthcare, proper healthcare in communities. Be part of the conversation. 0709 602592 by text, WhatsApp, and ask that question, share your opinion or share your comment through that WhatsApp number, as you are part of the agenda this morning on Good Morning Uganda. Now, in your view, in your experience, what are some of the challenges that are stopping or have barred proper healthcare or quality healthcare in Uganda's healthcare systems?
Yeah, I think number one, there are those things that we cannot control. Yeah, for example, I always use Kasanda because that's where I am. There are things that go back to, that are structural, administrative. For example, I've talked about the staffing levels, okay, which whereby I've been working at almost 38% of the staffing levels in health.
Right. Yet
these are very key people that we need in our community. So that is entirely administrative. But like I said, I'm glad that government has taken it up, and we are recruiting. We're soon recruiting more staff, and I think the recruitment has also been ongoing. Then we have issues to do with attitude and character. Those are really entirely personal. Yeah, and sometimes you hear of the attitude, the way we teach, whether the way we treat the clients. I'm one person who believes in respecting whoever comes to my area. And I think that's why I've taken all this time when I'm in Kasanda, because the way you come to me is the way I treat you. So sometimes you find that our health workers, not all of them, have issues of attitude.
True.
And I've been a victim, because I will not mention, I think like 4 months ago, my daughter underwent eye surgery, and I went to one of the hospitals. I thought by going to a VVIP, I would be getting some service that is quite relatively okay. But it was what I found there, in that even the doctors themselves tell you that they can actually be frustrated by a nurse. And it goes back to attitude, because I was literally forced, after my daughter was operated in theater, because the nurse that was supposed to be on duty, somehow, I don't know if she forgot or what, myself and the doctor, I had to literally carry my child out of theater. I am telling you, it was very sickening, it was very heartbreaking, but I was like, the doctor operated her, she recovered. Remember, this is a young girl, a young child who was like 2.5 years. And she just told me, Phoebe, let's find a way to back to the room, so that will go, you know. And so what are you going to tell me, honestly? And
this nurse is being paid by the government? Yes,
and they're being, it's not government, it was private. That one I cannot relate on.
Right,
yeah, but I know it cuts across. Yes. I'm using myself as an example because it cuts across everywhere, okay? But the issue of attitude towards work is something that I want every Ugandan, especially those of you who are enrolling into healthcare and also nursing and health.
Right.
You need to ensure that all of us have problems, okay? But most cases, like what they always tell us, leave your problems out, because if you've come to render service to a person, this person doesn't know. This person has come to you, and they're not the cause of your issues, because you don't know. They also didn't sleep. So if you do not treat me the way I think I should, even just explaining to me without backing at me. You know, you've heard of scenarios where you go to a doctor, you're sick, but then the doctor goes there, but the fact that they have talked to you, you find that you actually end up being given a Panadol or what. Now, us who have issues of fatigue and what, you go there feeling that the whole body is aching. But when you get there, you do all the diagnosis and what, and then they tell you, having paid like over like maybe 50 or something, and they tell you there is nothing wrong with you. But then just that explanation makes you feel better, so that you go and do, you know, you do what you're supposed to do. So, nurses and doctors out there, yes, there are issues. The working condition might not be favorable, but at least ensure that you do what you're supposed to do as a person.
Right.
Yes. So I've talked about attitude, I've talked about absenteeism. So to me, I believe those are some of the factors.
The major challenges.
Yeah, the major challenges that affect us.
Right.
As
Thank you so much for being on the show. Now, of course, Ruben has to come through with the sports update, and that means it's our cue for us to complete this conversation. A lot I have learned. I don't know about you, but a lot I've learned. And over time, one of the things I've learned from the current RDC of Kasanda District is the fact that an empowered community will always help play the game as it's supposed to be in service delivery. And she reiterates it even this morning. An empowered community is one that has helped us serve better. Many things we're learning here. What are your parting shots?
My parting shots is I want all of us to reflect on where we want to go, where we are and where we want to go. Because when you do not understand where you've been and where you're at, it will not give you the energy to move forward. So this goes, since you're talking about health, I want to make an appeal to the entire community. By just that one decision you make as an individual, the choices you choose to make at that time might actually save you the years ahead. Because we keep asking ourselves, what is that thing that our forefathers were doing different? There is nothing special that they were doing different. That is what I've got to learn. But it all starts with you and what you're able to do now in that situation, in that position of power you are, to ensure that you save a life or help a community or help a vulnerable person who is unable to be able to get what they're supposed to get.
Very well, thank you. Nalongo Phoebe Namulindwa, RDC Kasanda District, has been speaking with us this morning on ensuring the role of RDCs and RCCs in ensuring proper health care within communities. Thank you so much for being on the show. Ruben is coming up with the sports, and of course Chirabo will be back with the extra. Good morning.